Hello and welcome to this video about what causes asthma. So, asthma is a chronic lung disease that affects millions of people worldwide. It is a condition that causes inflammation and narrowing of the airways, making it difficult to breathe. While there is no cure for asthma, understanding what triggers the condition can help people manage their symptoms and live a healthy life. In this video, we will discuss the underlying cause of asthma, including genetic and environmental factors like allergens, irritants, exercise, infection, and emotional stress. So, let's dive in and learn more about what causes asthma. So, first, we will discuss about what is the underlying cause of asthma. So, the underlying cause of asthma is the inflammation and narrowing of the airways in the lungs. This inflammation can be triggered by a variety of factors, including exposure to allergens, irritants, physical activity, respiratory infections, and emotional stress. When airway become inflamed, they become more sensitive to these triggers, which can cause them to narrow even further, making it difficult to breathe. This narrowing of the airways is what causes the characteristics symptoms of asthma, such as wheezing, coughing, chest tightness, and shortness of breath. And understanding the underlying cause of asthma is key to manage the conditions effectively, as it allows people with asthma to identify and avoid triggers and take steps to reduce inflammation in the airway. So first, let's talk about allergens. So allergens are one of the most common triggers of asthma symptoms. An allergen is a substance that can cause an allergic reaction in some people. When a person with asthma is exposed to an allergen, it can trigger an inflammatory response to the airway and causing them to narrow and making it difficult to breathe. Some common allergens that can trigger asthma symptoms include pollens from trees, grasses, and weeds. Also, dust mites, uh, pet dander from cats, dogs, and other animals or pets, mold spores, and cockroach droppings. People with asthma may also have allergic reaction to other substances, such as certain foods, medications, or insect stings. It's important for people with asthma to identify and avoid this specific allergen to prevent asthma symptoms. This may involve making changes to their home environment, such as using allergen proof covers on beddings, or removing carpets, or avoiding certain outdoor activities during peak pollen seasons. In some cases, allergen shots or medications may also be recommended to help manage asthma symptoms triggered by the allergens. Exercise. Exercise induced asthma is a type of asthma that is triggered by physical activity. When a person with exercise induced asthma engages in physical activity, such as running or playing sports, it can cause the airway to narrow and lead the asthma symptoms. The exact mechanism behind exercise induced asthma is not fully understood, but it's thought to be related to the drying of the airways during exercise and increased breathing through the mouth. Respiratory infections are another common trigger for asthma symptoms. When a person with asthma gets a respiratory infection, such as a cold or the flu, it can cause inflammation in the airway, leading to asthma symptoms. Infections can also make asthma symptoms worse in people who already have asthma. Some common respiratory infections that can trigger asthma symptoms include the common cold, influenza, the flu, respiratory sinusitis virus, RSV, pneumonia. To reduce the respiratory infections, people with asthma should take steps to avoid exposure to viruses and other germs, such as washing their hands frequently and avoiding close contact with the people who are sick. It's also important for people with asthma to make sure that they are up to date on their vaccinations, including the flu vaccine and the pneumococcal vaccine. If a person with asthma does get a respiratory infection, it's important to monitor their symptoms closely and follow their asthma action plan. This may involve using quick relief medication to manage asthma symptoms, and in some cases, seeking medical attention if symptoms worsen or do not improve with the treatment. By taking these steps, people with asthma can reduce the risk of respiratory infections and manage their asthma symptoms effectively in an infection if an infection does occur. And then emotional stress. Emotional stress is another potential trigger for asthma symptoms. When a person experiences emotional stress, it can cause the release of hormones such as adrenaline, which can lead to changes in breathing patterns and potentially trigger asthma symptoms. Some common sources of emotional stress that can trigger asthma symptoms include anxiety or panic attacks, depression or other mental conditions, a high level of stress at work or home, major life changes or traumatic events like death or birth. To manage asthma triggered by emotional stress, people with asthma may need to take steps to manage their stress levels. This may involve practicing relaxation techniques such as deep breathing, meditation, or yoga, or seeking support from a mental health professional. In some cases, medication may also be prescribed to manage symptoms of anxiety and other mental health conditions. It's important for people with asthma to be aware of potential triggers of their asthma symptoms, including emotional stress, and to take steps to manage these triggers effectively. By working with their healthcare providers and following their asthma action plan, people with asthma can minimize the impact of emotional stress on their asthma symptoms and improve their overall quality of life. Genetics also play a role in development of asthma. While asthma is not caused by a single gene, researchers have identified multiple genes that may contribute to a person's risk of developing asthma. Some of the genes associated with asthma are involved in the immune system, which plays a key role in the development of asthma. Other environmental triggers, such as allergens or irritants. Having a family history of asthma is also a significant risk factor for developing asthma. If a person has one or both parents with asthma, their risk of developing asthma is higher compared to people without a family history of asthma. While genetics cannot be changed, people with a family history of asthma can take steps to minimize their risks of developing asthma or managing their asthma symptoms effectively. This may involve identifying and avoiding triggers that can worsen asthma symptoms, working with a healthcare provider to develop an asthma action plan, and taking medication as prescribed to manage asthma symptoms. So, in conclusion, asthma is a complex condition that can be caused by a combination of factors, including allergens, irritants, exercise, respiratory infections, emotional stress, and genetics. So, these triggers can lead to inflammation and narrowing of the airways, leading to symptoms such as wheezing, coughing, chest tightness, and shortness of breath. While asthma cannot be cured, it can be effectively managed with the right treatment and self care strategies. This may include medication to manage asthma symptoms, avoiding triggers that can worsen asthma symptoms, and developing an asthma action plan in partnership with a healthcare provider. By understanding the potential triggers uh, of their asthma symptoms and taking steps to manage these triggers effectively, people with asthma can live happily, healthy, and active lives and minimize the impact of asthma on their daily activities. Thank you.